Welcome to Biztech's Health and Wellness Show, where we focus on equipping you with the knowledge on health and wellness to help to ensure that you, your families, and your employees are safer, more productive, and healthier. Now, today the conversation is about improving lung health after COVID-19 infection. Now, to bring insights on this topic, we have Dr. Ashari Yunus, Consultant Pulmonologist at Institut Jantung Negara, the National Heart Institute of Malaysia. Now, welcome to the show, Dr. Ashari.
Thank you.
Now, Dr. Ashari, could you start by giving us a quick introduction about yourself and your specialty?
Yeah, good evening, everyone. I'm Dr. Escheri. I'm the Consultant Pulmonologist at the Institut Jantung Negara or National Institute, and was trained in the respiratory in the year 2000, and I graduated from UKM in 1987, and then I pursued the studies for internal medicine at the University of Science Malaysia. Then followed by that, I was sent to Australia for the training at the Royal Prince Alfred Hospital in Sydney in the NIV and sleep medicine and also general respiratory, and further training at the Svensson Hospital for the lung transplant, then followed by the at the Biztech Hospital in Paris for the primary hypertension. That's my field, and I'm in this field since 2000 till now.
So, Doc, COVID-19 affects lungs and the respiratory systems significantly. Could you enlighten the audience in terms of what is the impact?
Yeah, definitely the COVID-19 virus go to the lungs first because this airborne disease. It goes to your breathing every time you breathe. Then the virus go to the lung and infect the lung, especially the alveoli of the lung. Then can cause the inflammation in the lung, and as a result, that all the lungs inflame, and or the inflammation happen in the lung and the damage of the lung. And this is depend on the damage of the lung, depend on the viral load and also the virulence of the virus. So if the virus is very high, then the lung infection is very high in the lungs. Damage is very high, and so the virus, if the virus is very virulent, then the lung make a lot of damage. So as the result, some people might have the only mild infection because they have good immune defense mechanism, and the virus may be just patient might be just got mild symptom, minimal symptom like such cough, fever, and some people might be breathless because not enough oxygen to the body. So because the lung affected, as we know that the oxygens exchange occur in the lung from the environment to the body through the lung. So if the lung damage, not enough oxygen to go to the lung, go to the body. So as a result, patient might have breathlessness, or the patient might have we call this very bad condition, very severe, then cause need for oxygen and sometimes need to put on the machine to make sure that the oxygen goes to the body. Yeah.
And Dr. Dr. Ashari, what happens if, for example, in severe cases, it impacts several parts, besides the lungs and the respiratory system? Is that damage reversible?
When they go to the lungs, it might be affected to other organs as well. Might be involve the kidney, the heart, the nearest to the heart, then followed by the kidney and the liver. This might affect in the very severe case. Patients usually at the time patient might be drowsy, and patient might be very bad conditions.
And so, what are the common post-COVID lung symptoms? So you said it's drowsy.
Yeah.
What else?
So the lung, the COVID, when the COVID virus go to the lung might be damaged. The initial part of the COVID virus infection, they might be present with we call the Acute Respiratory Distress Syndrome or ARDS. The lung, they involve the whole lung. involved by this virus. So there's no way the patient can breathe. And that's the time that patients need help from the, we call the ventilator, to help patient to breathe in. But sometimes the lung might be damaged, just we call the organizing pneumonia, we got lung affected by pneumonia, and then later on complicated by the fibrosis, or they might be we call the primary embolism. This is the complication may face after 10 to 14 days of the infection, viral infection. Yeah.
And so then this is where the long-term implications come in, where it's irreversible, correct? Because basically the lungs are already damaged.
Yes.
And how does this, in terms of age group, doctor, according to your study, the research that's been done, and also from empirical evidence of yourself working on patients, what sort of age group really gets impacted severely from lung complications?
Usually, that's a good question, Baron. I think everybody should know about this. When you get older, your defense mechanism is less compared to young people. And usually elderly means that here about 60 and above. But it should involve the young patients who are 50 and above, if they have the comorbid factors like the patient is so obese, patient diabetes, or high blood pressure. These risk factors give easier for the COVID infection to be infected to the lung. Yeah.
So, Dr. Ashari, you've just brought up an interesting point. Essentially, which is not clear to many people out there, your personal health and how you look after yourself is going to impact how severely you actually suffer from COVID-19. That's news for me. I didn't really realize that. I always thought it was a recovery stage. Can you tell us more a little bit about that?
Okay, that's very important for the patient look themselves that as general well-being. So the patient's not sick, no other risk factors like if you have diabetes, you have to control your diabetes very well, and you have hypertension, you have to control hypertension. If you had these risk factors, or if you're obese, then you have to control. If you, let's say you have diabetes, if you not control, there's a risk factor there, and your blood pressure is high, then you not control it. Or you have any heart disease, there's a risk factor for you. And because the immune system, our immune system is not very good, if your immune system not very good, easier for infection to come in. Let's say you patient, let's say bronchial asthma or COPD on the steroid, too high steroid, then it's not good as well. Or patient on the having cancer on the chemotherapy is not good. This patient can look at themselves how to go about it, you know, to avoid the infection. They have to look their own risk factors. Yeah.
Okay, so that's interesting. Then what we need to do then on a personal level, if you don't have major health complications, is literally, I suppose, then all the right things from a basic. Good nutrition, is it good nutrition? It is exercise.
Yes.
It is taking supplements.
Okay.
Is that the case, Doc? Is that what we need to do to look after ourselves?
Yeah, good nutrition is very good. To emphasize on good nutrition is very good. Balanced diet is very important. And then some supplement, I'm not that encouraging people to take some supplement, because in our diet they have all the supplements, let's say vitamin C or multivitamin in diet. I think if you take good diet, it's enough for you already.
Okay. Now, how can for me as a patient, if I've just suffered from COVID-19, perhaps because I have had both my vaccines shots, I got COVID. Not so severe, but I'm recovering. My lungs were affected. How do I help myself to improve my lung capacity and my overall respiratory health after recovering from COVID-19?
Oh, this is very, very interesting questions. I think the first thing you need to, I have to know your symptoms, the clinical symptoms. If you don't have symptoms, then you should be all right. But you have symptoms like you have cough, and you have the breathlessness, then you need to check your lung. You have to go and see doctors to check the lung. And after examination, we need to do some simple tests like look at the oxygen level in your blood. So by monitoring oxygen level, and so we do the, if necessary, we do the arterial blood gas to look how percentage of the oxygen in your blood. And also you have to look the X-ray. Sometimes we need to do the CT scan to your chest, and probably then we need the lung function for you. So this is how do we look at the patient when the patient come in for the COVID assessment. Right?
Okay, now today the government, because of the need to reduce pressure on the healthcare system,
that's right.
Some patients are basically asked to recover at home.
Yeah.
So I believe, and you can elaborate on that, the types of patients and so forth. Yeah. How do they help themselves, and how can their doctors help them to recover better at home to prevent escalation of their conditions?
Okay. COVID-19, we can categorize to them to five categories. Category 1, when the patient got COVID infection but no symptoms. Then category 2, when having COVID-19 positive, with the got symptoms such as, let's say I mentioned about fever, cough, and the breathlessness. And category 3, when the patient having pneumonia. And category 4, when patient pneumonia with low oxygen. And category 5, systemic. Systemic means involve all organs, even the lung, the cardiac, the heart, the liver, and also the kidney. So in the majority of the COVID-19 patient infected in the mild category, I mean the category 1 and category 2. And it's about 70% to 80% of the patient. And the category 3 and above, usually about in hospital, about 5%, 5%, 5%, so that. And the category 1 and 2, we can monitor patient at home. And in category 1 at home, then we can, if the relative or ourselves, we advise patient to have communicate with the hospital or any doctors to keep monitoring them. Let's say the patients feel more cough a little bit, then contact that doctors or hospital, nearest hospital or nearest clinic to check, I mean, to recheck again. And the other things we can, the patient or the people can buy the simple instrument like the pulse oximeter. It's very important. Okay. The pulse oximeter is you have to buy the standard pulse oximeter that approved by our MOH or any government body that involved with the healthcare. So you have to take pulse oximeter and you monitor that. You have to know the basic your oxygen level. Usually oxygen levels in our healthy adult is about 97-98%. But your pulse oximeter, when you're having COVID, the pulse oximeter more than 95% and it's good already. And you less than 95% and below, you should be careful. And when they're less than 90%, you should consult doctors whether you need to hospitalize or not. Yeah.
And you know, you're at IJN, have you been seeing a lot of patients that have come up with post-COVID-19 complications related to their lungs and respiratory system?
Yeah, I have seen that the patient discharged from the other hospital and came to see us because the complaint of breathlessness has not enough oxygen. When we check the oxygen level is very low, and when we do the investigation, like we do X-rays and we do lung function tests and a CT scan, we found that lung involvement is very bad. Lung involvement. This post-complication of the COVID-19. The post-complication that we've seen is we call the organic pneumonia or lung fibrosis, and also pulmonary embolisms that we have to tackle and treat the patient accordingly.
And I suppose one of the things is because you're the National Heart Institute, you've got all the newest and the best equipment, right?
Yeah, we have equipment to tackle this COVID-19 very well. Yeah.
Now, I want to zoom out a little bit, and because you've got all this experience, I want to ask you a little bit about the macro challenges. So considering that this is an evolving infection, what are some of the challenges of keeping up with the science of this? Because so much of information, and also for you to then figure out what is the best treatment for patients.
Yeah. So usually, if patients are coming to see me with the COVID-19, so I straight away that look at the oxygen level. So, and of course, I examine the patient, and patient having some sign there. So I proceed patient to the, I do arterial blood gas. At the same time, I look the chest X-ray. If the, say, the level of oxygen less than 90%, so I proceed to arterial blood gas. And if the blood gas then less than 50%, and I proceed for HRCT or CT scan of the chest. So the problem is kind of chest that I can predict how many patients we can discharge without oxygen at home, or how many patients how many percent of the lung involvement then we can discharge with oxygen. I can predict that one.
I
So
see.
really,
And
yeah.
you know, it's interesting. What sort of and you may be the best person to answer this. I'm sure that different countries have been doing different studies to better understand the long-term effects of COVID-19, and especially the impact on the lungs and the respiratory system. Could you shed some light in terms of anything that yourself or people in specialists in Malaysia are involved with, and also some of the studies maybe overseas that are being done?
Yeah, personally, I look at the studies, a lot of studies on this post-COVID complications, but I've looked the issue of the lung complication that I'm look at the organic pneumonia and lung fibrosis. If, let's say, the lung involvement about more than 50%, then it's very difficult the patient to survive without oxygen. Patient need to use oxygen. And if the less than 50%, there's a chance that patient can breathe without oxygen, without the supplement of oxygen. And then if, let's say, involvement of the thrombosis, or we call it the blood clot in the lung, then we need to treat patient appropriately. We need to at least give medicine for 3 months, then we can repeat some scan again to look whether it's resolved or not. Fortunately, the primary embolism can resolve by the medications, but not lung fibrosis and organic pneumonia. It's very difficult to reverse this.
I see. So in other words, because we've got so many cases of COVID-19 now in Malaysia, IJN as a thoracic center, is there a plan to expand this because to cater for post-COVID-19 care? Because obviously there is a demand for that.
Yeah. Lately, we tackle the few patients some from the private hospital sent to us for the helping the very severe patient with COVID. So we use the new instrument we call ECMO to tackle the problems. So, but this very unfortunate. Some of patients can't recover by this ECMO because it's very too bad lung damage.
Is that because they've come to you too late?
Some of patients come too late, some early. The late, we cannot accept it. It's very difficult. We know the prognosis is very bad, but if they come early, but if lung involvement is too bad, then it's very difficult as well. So as I told you just now, if the 50%, less than 50%, there's a chance to recover. But more than 50% to recover is very difficult. Yeah.
I see.
Because we have two lungs, right lung and left lung.
Yes.
So going together. So if the more than 50% involved, then very difficult. The people can survive with the one lung. But if the lung more than 50% involvement, then it's very difficult.
Dr. Ashari, it's been a fascinating conversation. But before we end this conversation, what are some final thoughts and advice you would like to leave us with before we end this conversation today?
Yeah, I think I advise people. Once you have to follow the SOP, standard of procedure. Like for example, hand washing, wear the mask, social distancing, avoid crowded area, and avoid gathering, and isolate COVID-19 patients. This is very important. And number 2, you need vaccine. What type of vaccine you need vaccine, because you have to protect you, and also to give the immunity to you to protect virus coming into your body. Yeah, these are 2 things. This is very important. Yeah.
Dr. Ashari, thank you very much for taking your time to come on the show.
Thank you.
I'm Brian Fernandez, and we've been speaking to Dr. Ashari Yunus, Consultant Pulmonologist at Institut Jantung Negara, the National Heart Institute of Malaysia, on Biztech's Health and Wellness Show. This video will be on our Facebook and LinkedIn sites, as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thanks a lot for tuning in.